Thank you very much, class, for the nice introduction. I'm happy to present today the human health, how it's changing with future climate change. So I hope you can see my presentation well. So this work has been done together with other institutes, and in order to retrieve the interesting user requirements, we had a questionnaire that we sent to many people in the community. Those questionnaires, they were supposed to ask for user requirements, how people use climate information nowadays, what are the gaps that they face, how CDS or C3S can meet their needs, and what specific functionalities they require. And then several workshops were taking place with a big user community, and those were held at different institutes in Lithuania, Belgium, Italy, and Hungary. And there was a synthesis of these user requirements from the questionnaires and the workshops. This work was focusing in the end from all the user requirements with different institutes and different communities, focusing on 4 different topics, which was heat and cold, which was on pollen, which was on vector-borne diseases, and which was on urban climate. When talking about future climate change challenges, there are 2 main topics that are of interest. And those were extreme temperatures, because they are amongst the most natural disasters for human lives. Then high temperatures and heat waves, they have an impact on health in terms of premature death and worsening of health conditions, especially among the subgroups most at risk. The effects of heat across Europe are heterogeneous, both spatially and temporally. So there is a need to look into the spatial variation, and that's also why high resolution data are of interest. And then future climate change, so will also increase the burden of heat-related deaths in Europe. So there's also a need to look into mortality figures. And then second topic that is interesting when looking at climate change in the far future, with climate change projections, is vector-borne diseases. So they are spreading through Europe, and one of the mosquitoes that is of interest is the tiger mosquito, and this is transmitting 2 main diseases in Europe, which is dengue and chikungunya. And with climate change, the favorable conditions for this mosquito are increasing throughout Europe, and therefore it's interesting to study this spread of the mosquito. And so these challenges, they can induce adaptation and mitigation measures that are important to improve the response to help reduce these effects. So how we started with investigating how the climate change challenges for the health sector, how they can be investigated. We used Eurocordex data. We had a huge interest in Europe, as it was the sector information on European health. And so Eurocordex data were of most interest with high resolution. And I have to say that this project started in 2017, so it's a long time ago. At the time, CDS was really just starting, so it was really in the premature, like a very, very early stages. And so we used data that was available on the ESGF node, yes, and it was retrieved in summer 2018. And these were bias-adjusted data from the energy sector, actually. So I think it's related also to what Alberto presented earlier, although they were data that were gathered from a proof of concepts contract. And those data were derived from Eurocordex and bias-adjusted using the IPSL CDFT 23. I just noted it down for your interest if you would be interested in specific bias correction methods. So then an ensemble of 8 models was retrieved from this. There were a selection of models because some of the models were not sufficient for our study, as we were looking into heat waves, for example, or which need like consistent number of days. So we wanted to have the models that have the same kind of temporal coverage. And so we derived 8 models that were of interest for our study. And so we looked also how to derive uncertainty. And so the calculation of the indicators was done by defining yearly statistics per model. Then we took a running average over 30 years in order to decrease the interannual variation, and we took a midpoint of the year plus and minus 50 years. So we end up with a time series which lacks actually the 15 years of the beginning and the end point. And then we defined an ensemble mean and an ensemble standard deviation, which is easy to use for the end user, especially the people we collaborated with in health institutes. They were not used to using complex formats and so on. So they wanted to have something that is of easy use for them in their reporting and their communications. And we did an additional 20-year smoothing standard deviation again to decrease some interannual variation. So this is an example of a plot that we derived, a number of heat wave days in this particular case. We also did a regridding of all the models to regular lat-long, which is then the 0.1 by 0.1 degree. So the highest resolution from Eurocortex. Here you can see the data sets that are available on CDS. So there are a number, you can easily find them by just going to CDS and in the search filters, just enter health. And you will come up with the 4 data sets that we have produced. One of them is, 3 of them I mentioned here today, but there is also a big effort done in the project to model urban climate. And we have modeled urban climate for 100 European cities for 10 years, which was also a big part of the project, actually. And then here you can see a set of applications that were developed within the contract and are available in CDS. Again, you can go to applications page and then you can select the sector of health and you will see the list of applications that are available. Here you can see the data sets that we produced. You can see temperature exposure for maximum, minimum, average temperature and different seasons, all percentiles to see extreme, to know extreme statistics on the different variables and on 2 scenarios, so to have some uncertainty also. We produced indicator on the suitability of the survival of this tiger mosquito, which is in Italian name, it's called Aedes albopictus, and also the season length. There are also yearly statistics, so it's a season length of a number of weeks per year that it survives, and this is only due to climatic conditions. And then another indicator on the heat waves and cold spells, where different definitions were used, but I will go into that later on as well. So here you can see an example of an application on temperature exposure. In this application, it's a dynamic application with live mapping and an additional chart being shown by clicking on a country, or in a higher NUTS level. If you would zoom into the map, you can see higher NUTS levels appear, I think until NUTS level 3. And then you can select the time period. You can select also the season that you're interested in, the statistic, which is then the choice between mean, minimum, maximum temperature, and also statistic, which is then these percentiles that I've shown before. And then you can see a graph showing the uncertainty, like the mean and the standard deviation around that mean from the years that are available in the dataset until 2086, which is then this 30-year average actually between 2071 and 2100. And then you can see a carousel image showing also the different time periods and scenarios, which is then a zoom on the country or on the region that is selected. And then in a second example, you can see heat waves. We have used 3 different definitions. And then again, the same logic appears for this application where you can zoom in and out, showing different levels of NUTS layers, where you can see a graph appearing with the mean and standard deviation, and another carousel showing over the different periods and the different scenarios. And so the definitions that we have used is one which is we call the climatological definition, which is used also in Eurocortex community, which is, I don't know by heart anymore. It's about having a 6-day it's a percentile based definition for a number of days that has to be succeeded. I have to look into it again more in detail. Then there was another one on the health related, which is actually derived from a project which is called Euroheat, which was WHO funded project and European Union funded project, which is a big reference in the health community. So that's why we have chosen this definition as well. And then there are a set of national and regional definitions included. This is based on the knowledge from the people, the communities that we've worked with in the project. And they are visualized on a map as well, where you can see in this example, it's a zoom on Italy, where you can see the regional definitions colored in small areas. And so this is the regions where we have the definitions for them. If you would see a zoom in and out, you can see more regions appear. And they depend on different thresholds, percentile-based or value-based thresholds, or different time periods, different variables that are used for the definitions. A third application that is interesting is looking into the threat of the tiger mosquito. So here we visualize the indicator on suitability and also on season length. However, this is not yet published, so it will be published soon. But the suitability index is already available on CDS. And again, it's the same logic that appears. You can select a country or a region depending on the zooming, and then you will see a graph representing the mean and the standard deviation around the indicator for different years, and a carousel image that shows the country or region that you selected more in detail. And the logic behind the suitability indicator in this case is based on 3 criteria. One criterion being the annual rainfall. There is a sigmoidal function that applies here. Also for the January temperature, it has to fall below and above a certain threshold, and the summer temperature, which is also defined within a certain range. So I want to mention again, this was based only on climatic conditions. So it is not related to occurrence data. So there are no real data embedded. So there is no species distribution modeling embedded in the provision of the indicators. Then last, we have a mortality application, which shows for 9 cities in Europe, the number of attributable deaths to heat waves. And this was done using heat wave data that I've presented before, the indicators that we have, using the Euroheat definition, as it is really health related indicator. So that was the most important definition to use here. And the effect estimates for the different cities, they are derived from a previous literature that was done by the people that we've worked with in Italy, in the Lazio. And actually it's based on a regression model that estimates the relative risk of mortality on a heat wave day compared to the risk of a non-heat wave day. So that's how they define the relative risk. And then this relative risk is multiplied by the number of heat wave days per year. And that's the way how you come up with a yearly number of attributable deaths to heat waves. And then this application provides you, first of all, just the number of heat wave days again per year. So it's a bit a copy paste of the previous application. But then again, there is an additional zoom on attributable deaths, and there are 4 different scenarios included. I'm not talking about climate emission scenarios, but I'm talking about socioeconomic scenarios. So there is embedded a no socioeconomic change, an adaptation scenario, which is quite a rough estimate of 30%, just also based on literature saying like, if adaptation measures are taking place, a reduction of 30% of attributable deaths will occur. This can be quite rough, but it's based on literature, and any other complexities can be involved, of course, in the future. Then the second one a third one is on the population, so population increase change in the future, which can be also important. And then the fourth socioeconomic scenario on population and adaptation taking into account. And these numbers can be visualized in this application. So that's what I wanted to present for the European Health Service. Please, I also want to mention, like Alberto mentioned, there is a lot of user documentation available in the different applications, in the data sets also. There are also facts. There is a lot of information, and if you still would like to gain more details about something, you can always contact me or Chiara, but you can also contact Philippe Lefebvre from Vito. I have to acknowledge also Vito, because all this work has been done during my time at Vito, so it's also important to acknowledge them. Thank you very much for your attention.